So good morning. We're thrilled to welcome you to day one of the DFCM conference entitled DFCM, Strengthening Health Systems Through Academic Excellence, Connection, and Collaboration. Thank you for joining us to celebrate the amazing work of our colleagues, learners, staff, and teams. And we're so excited to be together in person once again in this beautiful venue. My name is Allison Merbaum. I'm the Faculty Development Program Director in the DFCM and the chair of this year's Conference Planning Committee. We have been working tirelessly over the last 8 months to put this program together, and I'm excited to be able to bring you the culmination of these efforts today. We have some special folks in the audience today, and in particular, I wanted to welcome and thank our chair of our department, Dr. Danielle Martin, and our vice chairs, Dr. Risa Freeman, Melanie Henry, Tara Curran, Peter Selby, and David Tannenbaum for their tremendous support and advice in ensuring that the content of the conference appropriately reflects the many diverse programs and activities of our department. You'll hear from many of them today. We also have a number of international colleagues here today, many of whom will be co-presenting, and we're grateful that you're here with us today. We're remembering Dr. Barney Giblon, who was a longtime member of our Conference Planning Committee, who passed away this year and unfortunately isn't here with us today. We're excited to be back together in person this year after having to transition to a virtual conference the past several years. The Conference Planning Committee wanted the opportunity to feel that sense of connection that makes the culture in our department so special and unique. Today, we have many opportunities for networking and collaboration, and the space to explore and highlight our new department strategic plan with the 3 pillars of community, leadership, and relationships. You'll see around the venue various activities for you to share your thoughts about the conference, about our department, and how you see our strategic plan reflected in the academic work being showcased today. Feel free to jot down your thoughts and ideas using the sticky notes and add it to the mini poster on your table, and we'll collect the sticky notes and add them to the large poster in the main hall. It's an opportunity to be creative and have some fun with it. We have our amazing DFCM staff snapping photos and capturing video snippets. And we hope you'll stop by our photo stand and make memories with colleagues and friends. Please tag us on social media with the hashtag DFCM conference and at U of T Family Med. You'll see the agenda for the conference today on the screen over to your right, but I'll briefly take you through how the day will look. In a moment, I will welcome Danielle Martin for a chair's address and land acknowledgement. Then our first plenary of the morning will be the Walter Rosser Lecture with Dr. Lawrence Lowe, followed by research presentations from several of our DFCM faculty members. Following a short break, we will move into our morning workshops. During lunch, we will also have networking tables featuring some of our exciting DFCM offerings. We invite you to grab your lunch and meet new people or catch up with old friends for a chat and hear about what's going on at any of these tables. You can also get some fresh air outside on the beautiful grounds or gather in any of the other free spaces. For our afternoon session, we'll start things off with a panel discussion moderated by our DFCM faculty wellness lead, Dr. Navshir Gill. While you may view the poster submissions at any time during the day, we will have a dedicated poster session from 2:30 to 3:00 p.m. and then we will move into our final workshop session of the day. Just a map of the space here. We're in the presentation hall. Lunch will take place. So the networking tables will be further down the hallway in the bow. As well as additional tables in the forum, and lunch will be served buffet style just past the poster tables. There are some workshop rooms on this floor, and then if you follow the hallway down and turn towards your left, there's a staircase that takes you up to the additional workshop rooms on the second floor. So please refer to the program booklet that you received by email, dfcmconference.ca, our conference website, or ask any of our staff if you're unsure where to go. And your workshop assignments are also on your name tag. This conference wouldn't have come together without the support of our Conference Planning Committee, whose names you'll see here. In addition, our abstract vetting committee reviewed over 70 abstracts to select our poster, oral paper, and workshop presentations. Many thanks to our DFCM staff volunteers who are assisting us in every possible way throughout the day today. And finally, we owe a huge debt of gratitude to Danielle Dudica, our conference administrator, who has managed every detail from the start of our planning over the last summer through to the conference today and tomorrow. We're so lucky to have you on our team, and we so appreciate all of your efforts down to the fine details that you've been able to put together to help today run so smoothly. It is now my honor to introduce Dr. Danielle Martin, the chair of our department, to welcome you to the conference today. Dr. Martin is a professor in the DFCM and practices clinically as a comprehensive family physician at Women's College Hospital. Danielle holds a Master's of Public Policy from the School of Public Policy and Governance at the University of Toronto. She spent 8 years as a major hospital executive, most recently as Executive Vice President and Lead Medical Executive at Women's College Hospital, where she was also medical lead of the hospital's COVID pandemic response. At Women's College, she also led the establishment of Women's Virtual, Canada's first virtual hospital. Since taking over the role of chair of the DFCM in 2021, Danielle has brought her innovation, vision, and energy, and you will appreciate the impact of her leadership in many ways through the conference over the next 2 days. From my own experience, it has been incredibly inspiring to work with you over the past year and a half.
Well, welcome everyone. I'd just like to invite us all to just take a deep breath and just take a moment to appreciate what Allison Mirbaum, Danielle Dudica, and Elisa Kim, who's in her final week as our communications lead, have done for all of us in bringing us together. It's a tremendous achievement. And among many other things, I think it is a testament to community. We will see that theme threaded throughout the day in a variety of different ways. The most obvious of which, of course, is the opportunity to come together in person, which I so appreciate. And as we think about community, the most important way to start on the right foot on a day like this is to understand not only the past, but the present contributions of our Indigenous colleagues and communities in helping us to build and shape what it is that we're doing together today. This, of course, is the traditional land that we are on today of the Huron-Wendat, the Seneca, the Haudenosaunee, and most recently the Mississaugas of the New Credit. And it is not a historical statement that I make. Our Indigenous colleagues and patients and communities are tremendous ongoing contributors and keepers of this land. I had the opportunity, some of you, has anyone seen the play Land Acknowledgement? It's been playing at the Mirvish Theatre. I think it may still be on, actually, an incredible and unsettling and really important piece of theater art for those who are interested. And I won't try to summarize it overly because it is one of those things that you have to see. But one of the ways in which this theater piece pushes its audience members is it's a one-person show. The performer stopping in the middle of the play and calling out to the audience, what book have you read this year by an Indigenous person? What theater have you been to? What object have you purchased? What piece of art hangs on your wall? What clothes are you wearing? And how are you contributing in an ongoing way to reconciliation, not only with your words in the form of land acknowledgements, but with your actions? And so I want to say that that is a principle to which I know all of us are deeply committed. And I want to express my gratitude to the Indigenous Leadership Circle of DFCM for the incredible leadership that they have been providing to our department in that regard. Another way that we are showcasing community here is by hosting this conference in this location. And I just want to say thank you to those who came from downtown, and maybe we all appreciate a little bit more what it's like to be a community-based faculty member who's had to drive down to the center of the city so often. As my colleague Jack Westfall said to me, you can't even see the ivory tower from here. And that is exactly as it should be. And so I really, I think this tremendous showing is proof, in fact, that we have faculty members from all over of course, the GTA and well beyond. And in fact, this is a great location to have the conference and a beautiful site. In addition to thanking, of course, our Vice Chair of Education, Risa Freeman, and thanking Dr. Allison Merbaum for her leadership, I also want to say we have a community member visiting from south of the border. Jack, do you mind just raising your hand? Dr. Jack Westfall, who's a visiting scholar from the University of Colorado. Many of you will know Jack's work. He's a tremendous leader in family medicine and primary care research and a real trailblazer in the area of community-based participatory research, among other things. He'll be hosting a workshop for our research community tomorrow, and we'll be around the DFCM in a variety of ways. So if you haven't met Dr. Westfall, please introduce yourselves to him, learn a little bit about his work and the way that we're trying to expand our community beyond our own borders and learn from other places in our discipline. I want to once again thank all of you for coming, and I'm going to hand it back now for the introduction of our very august keynote speaker.